foot and ankle is such an important area of your body. It kind of dictates the mechanical alignment from your contact with the ground all the way up to your knees, your hips, your back, your shoulders. The foot is made for stability, whereas your hands are made for mobility. And so we use the foot to help as our base as far as our walking or standing or activity levels. Trying to make that as normal as it can be and functional as it can be has a huge impact on joints and body parts above that level.
Ankle fractures are fairly common for us. Bunions are very common to us as well. Those are probably one of the two most common things that we treat. Also, Achilles tendon ruptures and Achilles tendonitis is a fairly common thing we see as well.
Technology continues to evolve. A type of surgery we do for bunions in particular. We're pushing to do surgery through smaller incisions, which creates less soft tissue injury, hopefully less stiffness and less scarring, quicker return to activity.
So something we're really excited about is that there is a newer device that's been developed actually by one of the physicians I trained with in New York that allows us to fix the Achilles tendon through a small 1-inch incision. We can actually pass this device underneath your skin around the tendon and capture the tendon through small poke holes and able to use this small 1-inch incision to actually reset the tension to your Achilles, which is the reason to do surgery. Ankle replacement specifically to me is kind of my baby. It is something that's taken a pretty big hold over the past decade. It's just a newer way of treating ankle arthritis that's much different than a fusion where you lack motion and it makes it difficult on the joints around it. I have one patient who had ankle arthritis on both ankles. She couldn't walk long distances, couldn't garden, and I recently saw her a couple of months ago and she walks without a limp and she's gardening and she's happy and her swelling's better. I find it hard to believe there's a job that's much more satisfying than that.
The beauty of having two foot and ankle surgeons in the same group is there's a huge amount of comfort in picking the other person's brain, and it's such a rewarding experience to be able to offer information or to ask for information.
It's excellent to have somebody, I would say gray hair, but I think I've got more gray hair than him actually, and he looks so young, but he's got plenty of experience that I've been able to lean on, and it's always nice when you've got the textbooks to tell you what to do, and sometimes it just comes down to an opinion on, this specific patient, they've got these issues, and someone who's been through that and done the experience and kind of knows what the outcome looks like, it's invaluable for me.